Okay, we're going to get started here. Do you suffer with a chronic condition? Hello, my name is Dr. Lin, and the goal of this video is to give you information on how we can help you with your chronic condition, naturally, without drugs or surgery. We want your body to function at its highest capacity so maximum healing can take place. Please watch the video in its entirety. It's about a half an hour, so get through it. It's very important. And when it's over, you're going to see why you have been suffering for so long, and it's going to give you options that you can take. If you have any questions, please email me at healthquest9443@gmail.com. We work with fibromyalgia, thyroid disorders, peripheral neuropathy, blood sugar issues, autoimmune disorders, multiple sclerosis, insomnia, migraines, and dementia, just to mention a few. We use a natural alternative approach using our innovative metabolic techniques. You see, all of these chronic conditions that people suffer with have something in common. And that something is that there is an autoimmune component, meaning that your body is attacking itself. Well, what do I mean by that? Basically, this means that antibodies have been formed and they are now attacking your own tissue. And there's a specific blood test that we can run from Cyrex Labs, and it's array number 5. It will tell us what part of the body the immune system is attacking. 90% of these chronic conditions that people have this autoimmune component. For example, 90% of thyroid conditions are autoimmune, and this is called Hashimoto's thyroiditis. The other 10% is something else. Maybe it's an underconversion, overconversion, or pituitary suppression. That's why I'm saying not all conditions are autoimmune, but the majority are if you have a chronic condition. Now, if the immune system is attacking one part of your body, it can very well attack another part of your body if it's given enough time. And it most likely will do that. What I'm trying to say is your whole body is on the menu. If the immune system is attacking your thyroid, it's called Hashimoto's. If it's attacking your myelin sheath of your nerves, it's called multiple sclerosis. If it's attacking your joints, it can cause rheumatoid arthritis. And the list just goes on and on. You know, the medical doctors really don't know what to do with these autoimmune conditions. So, how do you stop an immune system from attacking your body? That's probably the first question you should be asking yourself. There are 3 common denominators with patients with chronic conditions. Every chronic condition patient has inflammation, number 1. Every chronic condition patient is toxic, number 2. Every chronic condition patient has a poor functioning immune system, number 3. How do you know all this? Well, we look at your blood work. We check your ESR, your cortisol, uric acid, C-reactive protein, and your homocysteine levels for inflammation. If you're overweight, you're definitely inflamed. So first you want to decrease the inflammation. How do we do that, you may ask? Well, we use natural nutraceutical protocols, which might include you sipping on an infusion day throughout the day of co-curcumin, resveratrol, and Inflamma ND and cherry elixate. And of course, we'll put you on an anti-inflammatory diet, and there's many other things we can do. Second, you want to detoxify the body. If you smoke, you have got to stop now. So you have to detox, especially your liver. You've got to get off soda pop. You have got to stop eating junk food. You've just got to change your diet to start with. So to detoxify, you, we might do some mud packs or some ionic foot baths, maybe an infrared sauna, possibly coffee enemas if you're open to something like that. It's a great way to detox. And third, we want to build up your immune system. That's what medicine doesn't really know what to do with. Your medical doctor may give you a steroid such as prednisone, but this causes your liver to become even more toxic. Now, I'm not saying medicine isn't necessary. We definitely need them, of course. They are great at broken bones, heart attacks, strokes, infections. We need them. But where they drop the ball is with these chronic conditions. And this is where I put a lot of emphasis on learning. The problem with these chronic conditions, as I said, the immune system is out of balance. There are two parts of the immune system, Th1 and Th2. They have to be in balance for proper health. So the problems with these chronic conditions is that immune system is out of balance. They are either Th1 dominant or they are Th2 dominant. And this must be addressed. For example, if you are Th2 dominant, say you're up here with Th2, we want to give you things to boost Th1 so it will balance out. So to support Th1, we might give you formulas containing Th1 boosters like vitamin A, C, zinc, astragalus, echinacea, licorice, lemon balm, garlic, maitake mushrooms. Some of these mushrooms do an incredible job at healing. You don't have to believe a word that I'm saying. You can look all this stuff up on the internet and educate yourself. I encourage you to do that. If you are Th1 dominant, you want to give things to boost the Th2 system, which may include formulas that have pine bark extract in it, green tea. Our green tea is very potent. It would take 20 cups of you drinking green tea to equal just 1 teaspoon of ours. It's super potent, very good. You might want resveratrol, grapeseed extract, pycnogenol, lycopene, and caffeine, just to mention a few. Here's a big thing. 80% of your immune system is in your gut. If you have a chronic condition, the gut function is more likely than not bad. There are tests that we can do for gut function. Go to Cyrex Labs, array number 2. It's going to look at the lining of your intestine. It's going to look at your dysbiosis, which shows us how many good peria versus how many bad bacteria. It's going to look at leaky gut syndrome, which means that it's going to look at your intestinal wall that could be damaged from food sensitivities, antibiotics, poor diet, hormone imbalances. It's also going to look at the gaps between the cells to see if food particles and toxins are passing through your intestine and getting into your bloodstream, causing more of an immune system flare-up. How do you fix this, you may ask? Well, we have protocols. We put you on a specific diet called the Repair Program, and we give you certain healing formulas. Another big problem with chronic conditions is hypochlorhydria. This is where you don't have enough acid in your stomach to break down your foods. If you're over 30 years old, this is a definite concern. And when you have this hypochlorhydria, you cannot form what we call methyl groups. Methyl groups are important because they help in DNA cell replication. So how do we test for it? Well, we look at your blood work. We check your BUN, your total protein, phosphorus, and your globulins. If you're low in acid, it's imperative we supplement you with what we call HCl activator with meals. You need this acid to absorb nutrients from your food. We can also muscle test you for specific acupuncture points to also help guide us. A lot of chronic condition patients are drinking alkaline water. Please don't drink alkaline water, it's terrible. All it's going to do is alkalize your stomach. It doesn't alkalize your body. If you want to alkalize your body, you have to get fresh organic vegetables and fruits and juice them. Drink 24 to 30 ounces a day. It's super good for you. You may ask, where did I get my training that I am talking about this stuff and know how to treat these conditions? Well, I've trained with the Super Neurometabolic Group. It consists of over 500 doctors in the U.S., and we converse with each other about cases. So I am not actually just taking care of you myself. I'm actually consulting with 500 other doctors, and I'm also affiliated with top experts like Dr. Michael Johnson, Dr. Kevin Connors, and Dr. David Clark, whom all are specialists in functional medicine, neurology, and alternative cancer therapies. Not to mention the fact that I've been in practice over 25 years, so I've been around the block and I've seen a lot of conditions. And this should give you confidence in our procedures. So, what we do is support the body for maximum healing. It's all about achieving maximum healing. How do we do this? Again, I'm stressing to you. You must decrease inflammation, detoxify your body, and boost your immune system in any chronic condition. The medical approach is, well, they probably just kind of blow you off. You know, MDs think patients with chronic conditions are crazy, and they think it's all in their head and you need to see a psychiatrist. You know, you keep complaining of your condition. There's nothing wrong with you, Mr. Jones, because your lab tests are normal. How many times have you heard that? Keep in mind, lab tests are very, very wide. We use optimal ranges, which is a lot narrower. For instance, let's take TSH, which is thyroid stimulating hormone. The lab range for this is 0.35 to 5.5. We use optimal ranges, and the optimal range for TSH is 1.8 to 3. Do you see the difference? It's kind of like your oil light going on in your car way before you're empty, which is good. So it lets you know if something is wrong before you get sick, not when you are already sick. We want to catch the patterns before the problems start getting worse and rising and causing havoc in your body. This is why optimal ranges are so informative and important. So that's what we use. They'll also say learn to live with it. Have you ever heard that one? Get out and do some exercise. So the vast majority of chronic conditions are caused by an autoimmune disorder. And MDs they don't have a good idea how to address autoimmune disorders. Again, we must decrease your inflammation, detoxify your body, and boost your immune system. Now, the alternative approach in my mind is like the wild, wild west. You know, all this stuff on the internet. And the problem I've been seeing is that doctors are using lab tests, which I'm about to tell you about, and some are doing muscle testing. But they are not combining the two together. And honestly, I think you have to use an integrative approach. You know, what is best for the patient? You know, you just can't rubber stamp everybody with the same diagnosis and treatment. A lot of alternative practitioners are just rubber stamping patients. For example, you go to your medical doctor and you get Synthroid for your hypothyroidism. Bam, that's it. Hey, I'm an alternative doctor. Here's some iodine for your thyroid. You know, you have to check things out. It's crazy. My approach is integrative, and what is best for the individual patient. You know, no two fibromyalgia patients are the same. There are no two thyroid patients the same. There are no two psoriatic arthritic patients that are the same. You follow what I'm trying to say. So here's the deal. So how do you know what to do? Number one, you have to do the lab tests. And number two, you have to do the applied kinesiology where we do the muscle testing. And then we combine the two. And this makes it very much more effective. Your condition is a chronic illness. Your body has been sick for years. But you might say, it just started last month. No, it's been coming on for quite a long time. And now you have this label. Well, you're not a label, but you are a web of physiologic dysfunction. That's what you are. And you have these other health breakers. The following is a list of where causes of your condition may lie. Number one, gut dysfunction. Remember I said 80% of your immune system is in your gut. And we can find out if there's a problem here by doing the blood work. We absolutely need to fix your gut if you're going to get better. Number two, there may be blood sugar dysregulation. Your blood sugar should be between 85 to 99. These are the optimal ranges, not the lab ranges. Anything below 84 is low blood sugar. If you have this, you need to be eating every couple of hours and something healthy like carrots, celery, nuts, seeds, apples, maybe a hard-boiled egg. Hopefully it's organic. Now, if your blood sugar is 100 to 126, you have what's called insulin resistance or pre-diabetes. You need to get off refined sugar and refined grains and fruit juices. If you're 127 or above, well, then you're a diabetic and you're there. So when we send you for blood testing, you must fast for 12 hours and just drink water. You can't drink coffee because if you drink coffee, the caffeine is going to stimulate a hormone called cortisol, and it's going to dump sugar into the bloodstream, and it's going to skew your reading. We're going to want a hemoglobin A1C also, because this is going to give us a window of how your sugar metabolism is over a whole 3-month period of time. Way better than the fasting glucose. This should be about 5 or even less, if preferably. Number 3, you might have brain and neurotransmitter dysfunction. If your gut is inflamed or has problems, you're going to have brain problems. If you have migraines or seizures, dementia, Alzheimer's, brain fog, poor concentration and focus, then you're going to need to do certain things again to decrease inflammation. Number 4, there may be an anemia problem. You wouldn't believe how many people have iron deficiency anemia, B12 anemia, B6 anemia, folic acid anemia. How do you know? It's in the blood work that we send you out for. And we can help this with HCl activator. This will help the absorption of iron. If it's a B12 folic acid anemia, we have under the tongue formulas. Number 5, there could be lymphatic dysfunction. It is important to make sure this system is working properly because it's the garbage collector system. It's hugely important. Number 6, there could be liver and gallbladder dysfunction. How do we know? Well, there's the liver enzymes in the blood work. There's liver and gallbladder points that I can muscle test for. The end result is you want these things fixed to get better. Number 7, there could be energy production markers. This is a urine test that tells us how your carbohydrate, protein, and your fat metabolism pathways are working. As well as it's going to tell me if there's any detoxification pathways that are blocked in your liver. How do you know if you don't test for it? You have to find out. Number 8, There are electromagnetic fields. This is EMFs. You know, anytime you go through those doors that open automatically, where they scan your groceries, that is affecting us. It affects you. It's just not those electromagnetic fields coming from those huge power lines out there. These EMFs can affect you in an adverse way, so we will work with your EMFs. We may have to ground your computer. We may have to ground your cell phone if you're on it a lot. How do we do that? Well, we use Tektite. It's a material that absorbs EMF energy, and we'll put them on the batteries of your computer and your cell phone. Many times, with seriously ill patients, we can ground their whole house with what's called dragonite. Other things that emit EMFs are hair dryers, electric shavers, your Wi-Fi for your computer, TVs. So what we do is use an individually tailored natural protocols to allow your body to achieve maximum healing. Number 9, dental work. It might have to be done. Root canals are pockets for bacteria and viruses. You still might have amalgam fillings in your mouth, and it's loaded with mercury, and it's dripping into your system, causing you to become toxic throughout the years. Where's it going? It's going somewhere. So there are toxicity issues. If you are toxic, you might have to do a liver cleanse. What does that involve? Well, it may be doing coffee enemas and juicing. The coffee enema is the best way to detox your system. If you're not up for that, we can do other things like castor oil packs on your liver and give you certain formulas to draw toxins out of your body. We can do mud packs. They're highly effective. We may do ionic foot baths, maybe a Metasoak. These are fantastic for pulling toxins out of your body. There are different things that we can do to help detoxify your system. So you see, all of these things need to be functioning optimally for you to achieve maximum healing and to get better from your chronic illness. All of these things need to be done, not just some of them. So that's what you need done, and it's amazing because a lot of MDs out there won't do all of these tests. You don't need these tests, especially if you're an HMO doctor. It's crazy. Gluten, dairy, and soy are the 3 biggest causes of inflammation in your body. If you need to see it on black and white, we can do the tests. We can order the tests, or you can just get off the stuff and you can save yourself the money. So you're running these lab tests to see exactly what's going wrong with your body. You know, some people don't have enough money to do the lab work. This is where I do the muscle testing, which is also highly diagnostic. Applied kinesiology has come a long way. I did forget to mention that you might have to do a stool microbial 2005 profile. This is vital because it's going to show us if you have H. pylori. It's a nasty bacteria to have in your gut, or a parasite, yeast, mold, fungus, bacteria, viruses. You need that corrected if you're going to get better. It's drawing your energy. And finally, we are going to look at your adrenal glands, how your stress hormones are affecting your body. This has to be working right. This is a saliva test. Okay? We don't do all the tests at once. We do some, a little at a time. We use kinesiology using muscle testing. There are acupuncture points to test, and they are the thyroid, stomach, adrenal, sleep, liver, gallbladder, and energy points. So what I do is do the labs, and I do the muscle testing, and I incorporate the two together to get to the root cause of what is causing your chronic problem or illness. And we correct it, and that's how we help our patients heal and get better. So you see, we really don't treat anything. We don't cure anything. What we do is decrease your inflammation. You're probably getting sick of me saying that. Detoxify your body and increase your immune system. And that's how you're going to heal. It's your body. Your body has healing ability. If you cut yourself, it's not the ointment or the band-aid that's going to heal your cut. It's that innate wisdom of your body. So our goal is to help you find the most effective natural protocols to enhance your body's function so that you have the best chance possible of living a long, happy life. And that is our main goal. So, if what I've been saying here has any value and makes sense to you, we are here to help you, to get people better that can't get better anywhere else. They don't have anywhere else to go. They've been to every doctor on the planet. People will have to come. They come to us as a last hope. So when you're ready for this type of commitment, we are here for you. And my staff is here for you. But information without action is not going to help you. You need to take action and set up an appointment for a consultation, an examination. A diagnosis of a chronic condition is not a death sentence. It's just a name. We know how to fix it and address it. It does not mean you won't live a long, happy life. So here's what you have to do. Call our office at 708-574-4018 and set up a consultation. Fax me any recent labs, MRI reports, or whatever you have from the last 6 months to a year. Fax number is 708-529-3099. If you have any questions, email me at healthquest9443@gmail.com. So ask yourself, number one, how has your condition been affecting your relationships, your work, your social life, your recreational activities? 2, what is it costing you in time, money, happiness, and sleep? Number 3, a big one. Where do you picture yourself in the next 1 to 3 years if you let this problem continue? If it's not taken care of. Number 4, what is it worth to you to get help? So if you're willing to make a lifestyle change and invest in yourself and get your health back and getting better from your chronic condition, again, call our office. Visit us on our website. You can see a lot of information there at oaklawnwellness.com. You can see testimonials of patients that have been on the program at lifechangingcare.com. You can see all the successes of other patients that have gone through this. Fees. Insurance may cover a portion of your care, or it may cover all of it. We don't know until we verify your coverage. We do know all nutritional products are paid by the patient because insurance just doesn't cover it. Some of the lab work may not be covered. Sometimes you're just going to have to spend some of your own money. You just can't depend on insurance companies anymore. We have to be responsible for our own health. We do have affordable payment plans to fit your budget if necessary, and all finances will be covered up front. I want to thank you for listening to this video, and I hope it was informative.